Good evening, everyone, and welcome to a very special installment of the Pharmacist Virtual Learning Experience brought to you exclusively by Mandell's Clinical Pharmacy. Now, you may already know that typically our program is a live and interactive program where we have some of our nurses come on and talk about a number of different fertility medications and answer your questions throughout the program. But tonight, for the holiday, we're going to do something a little bit different. So what we decided to do was have our nurses come together and share their very personal stories about how they first got involved in and how they decided to stay in the fertility industry so that they continue to help patients just like yourself. And we're going to wrap the program up with a program discussing a little bit about how you can calm yourself down, especially during a very stressful, possibly holiday weekend when you're getting together with family and friends, called Healing Touch. So we're going to have a lot of different conversations here. You're going to hear from our nurses. You're going to learn more about them and what makes them tick and how they got involved in the program. And it's here for your support so that you can get back to what really matters and going through the process of helping to build your family. So thank you again. You can come back and join us next Monday evening at 7 p.m. Eastern Standard Time for a traditional virtual learning experience program. But for now, we're going to do a little something different. So I would like to say thank you for joining us tonight. Happy 4th of July weekend. Hope you had a great time. And now settle in and listen to our nurses share their personal stories with you. Thanks again, and I'll see you in a little bit.
My career in fertility did not start because of some personal history or a family member or a friend that inspired me. I actually had an interest in the field in nursing school, but unfortunately was not able to get the clinical experience as far as having a clinical rotation in the fertility world when I was in school. So once I graduated, I thought, what better way to learn more about this part of medicine in this community than to go for it and become an IVF nurse. So, just like I think many nurses think that they have some sort of passion before, I had an inkling that this would be something that I would like, but I never thought that it would have grown into what it is now. I have had the ultimate highs and lows with my patients and have created such a relationship, both from a clinic but a personal standpoint. You spend so much time together, from providers to nurses to lab staff with patients, that you really do have that kind of family component. And it's such a supportive community that I was pleasantly surprised at, how much I enjoy going to work every single day and helping my patients, who I now consider, friends to some capacity, just because a lot of patients don't share their journey as they're going through it with either other family members or friends, and they can feel alone. And we are so in tune with their cycle, and we're talking all the time, that I really feel a connection with my patients, and it's unlike I would have ever imagined. And even since I started in this role, I actually have had some of my own family members and friends disclose to me their fertility journeys that I had no idea they went through. And so I have just realized that the fertility community is so supportive, and there are so many outlets, no matter what your diagnosis is or where you are in your journey, that everyone is so supportive of one another, whether it's patient to patient, provider to patient, nursing to the patients. We see patients in our waiting room talking to each other and supporting each other. It's just such an uplifting community to be a part of. And I am honored to have been part of it. And I'm so happy that I decided to kind of take the plunge to see how I would enjoy this part of medicine. And I am so, so happy that I did.
Hi, I'm Karen Hammond. I'm a women's health nurse practitioner in Birmingham, Alabama. And I am the founding partner for a private practice also located in Birmingham, Alabama. So I'd like to tell you a little bit about my story and how I found my way into reproductive medicine and how I know now that it's my passion and my purpose. Back in the early 80s, there was a huge nursing shortage, and I was finishing nursing school, and I wanted to work at 3 to 11. I wanted to sleep until it got warm and then stay out with my friends to the wee hours of the morning. And I worked in OB and in the emergency room. Then I realized after some time had passed, while I loved both those departments, I realized that I really didn't want to sleep that late. And I couldn't really go out because my friends had jobs with normal hours. And so I thought about looking for a job with more normal hours to try to get away from shift work. And I heard about a gentleman at the university here in Birmingham who was looking for somebody for 6 months while his nurse finished graduate school. Thought, okay, I'm in my early 20s, I'm young and bulletproof. So I interviewed for the job, knowing it would give me good experience interviewing, if nothing else. And lo and behold, he offered me the job. So I took it. And it's embarrassing to think back how little money I made at that point. I took a pay cut from working in the hospital to working in an office, but I knew that it was going to be great experience for me. I knew very little about reproductive medicine when I started. And it was probably within the first couple of weeks that I realized, gosh, I can really learn a lot from my patients. Because I tell everybody that's new to this field that the patients know so much more than we do for a nice long time. And even after decades in this field, I realize how smart my patients are and how much homework they do and how really interested they are, not only in getting pregnant, but learning behind the scenes what's working, what needs to happen, and really being involved in their own health care. And that's one of the many things I love about reproductive medicine. Well, the 6-month job that I applied for ended up turning into a permanent job within just a few weeks. And I myself went on back to graduate school after a few years, got my master's degree. And I realized, for me, at least in academics, the more involved I was and the more motivated I was, I felt like I was getting pulled more and more away from patient care. And direct patient care is really my passion. So one of my physician colleagues and I, my collaborating physician, he and I decided we would start a private practice, which we did. And I worked with him for 30 years until he retired. Then I went on to get my doctoral degree, kind of at the encouragement of my mom. And I realized that even though that was probably my terminal degree, I doubt I'll go back to school. I'm still learning every single day. And more recently, I have wanted to try to make a difference for patients to bring the cost down for fertility treatment. I see people every day that have borrowed money, that are borrowing from friends, having yard sales, doing whatever they can to try to raise money to be able to afford a single cycle of treatment. And it kind of breaks my heart because I know that money is not a sole thing that makes for a good parent. I actually grew up of modest means, and I have the best parents on the whole planet. So in fact, I didn't really even know that we were of modest means because I thought my parents were just cooler than anybody else's. My mom could have some fun mealtime activities like find the meat in the casserole, and we didn't realize that it was just stretching the meat. We thought it was, just kind of a fun thing, and that my mom could cook more creatively than anybody else. But money really didn't. It wasn't a driving force for us. We didn't mind going to work when we were in high school. We didn't mind having that early drive and ambition. We thought that was just the way that it was supposed to be. So now my goal is to help people just like my parents to become parents. I would like to encourage the cost for all of the treatment to be able to go down. And hopefully with our new practice, we can be trendsetters. Now, having this as a career for, into my 4th decade now, has been absolutely amazing. It's been crazy to watch from the time the first IVF baby was born in this country to moving to using donor eggs and doing ICSI and retrieving sperm from men. Just all the different things that have gone on. Now we can tell if an embryo is chromosomally normal before we transfer it. So many advances have been made in the field. So it's never been boring for me. And I've always loved every single minute of it. You know, the job that I was hired for in the early 80s is certainly not the job that I have now. And that's not just a factor of my education and my career advancement. But I remember a friend of mine that I worked with for at least a decade. She was encouraging me to listen to a church podcast that she from her church, and the pastor talked about finding your purpose in life. And I went into my friend after I listened to the podcast on the way home from work and said, "Gosh, I was in tears. I just didn't know what my purpose in life was." I had always wanted children. I was older when I got married, and I was never blessed to have biological children. Have 3 amazing stepsons. But I wondered, gosh, what is my purpose? Maybe I don't have a purpose. And she said, "Karen, you are living your purpose. Your purpose is to build families." And when she said that, I realized she was exactly right. And once I put that in the forefront of my mind, that this is my divine purpose, it has made every aspect of my career, and may seem hokey, but actually of my life has really changed. I've always treated people well, but since that day, I have treated people even more like their family. My coworkers, my patients, my real family, I think it's just made a huge difference that I know that this is my divine purpose. And I bet if you talk to other nurses in this field, they have probably found the same conclusion that I have, maybe just in a little bit different way. So my goal in my last decade of my career is to make fertility treatment more accessible and more affordable. We're bringing down the cost of an IVF cycle by about 1/3. The medication use is less, and we're finding that our pregnancy rates are essentially the same without some of the other add-on cost, if you will, that some programs charge. So I hope to leave my career and my legacy to be as that of someone who's made an impact in our field and an impact on our patients. Whether people get pregnant or not, and we pray that every single one of them do, we want the experience to be a positive one, and a positive life experience, and hopefully an experience where they get to take home the prize at the end.
Hi, everyone. My name is Laurel Meyer, and I'm an IVF case manager in California. Tonight, I'm going to share my story of my infertility process in hopes that it helps you have the courage and strength to go through your journey. About 25 years ago, my husband and I started having trouble getting pregnant. We went to an infertility specialist and had a workup. I wasn't ovulating regularly. I knew this because I wasn't having regular periods. And my husband's semen analysis was fine. So we started on a treatment called Clomid. We started with 50 milligrams and had to keep going up every month because I wasn't ovulating. So we went from 50 milligrams to 100 to 150, still no ovulation. And by the time I got to the 150 dose, I started having nystagmus, which is the blurry, shaky vision. It's a very uncommon side effect of Clomid, but it means you have to stop. So no ovulation anyway, wasn't doing me any good. So next step, hysterosalpingogram. This is the dye test that checks to see if the fallopian tubes are blocked. I'm sure it's not a fun test. I'm sure many of you have had this test. It causes a lot of cramping. They put a tube, a catheter in through the cervix, and they instill dye, and they can watch the dye by X-ray travel down the fallopian tubes to see if it spills out the end or is blocked. In my case, they found that one tube was blocked and it had ballooned up like a sausage. This is called a hydrosalpinx. Now, in a hydrosalpinx, obviously the tube is completely blocked and doesn't work. My other tube was open. And thinking back to my teens, it made sense. I had been sexually active. I had contracted a case of chlamydia, which led to pelvic inflammatory disease, PID, and the leading cause of a hydrosalpinx is from PID. With pelvic inflammatory disease, the cilia that line the fallopian tube get damaged. So even if your tube is open, the egg still can't travel down the tube effectively to meet up with the sperm. So even if I had been ovulating regularly, which I wasn't, I still wouldn't have been able to get pregnant. So the next step was to remove my tubes. This requires a surgery called a laparoscopy. The surgery found quite a bit of adhesions. And so they removed both fallopian tubes and the adhesions. Next stop, IVF. I needed IVF at this point with no tubes. So we did 2 cycles of IVF. Both times I got a low number of eggs. I got not very good quality embryos. And unfortunately, I did not have a pregnancy. The third cycle of IVF, we decided to use donor eggs. And the only way we could afford to do this process is to split the eggs with another couple. So the eggs that were retrieved from the donor, we split with another couple. We got one not very good quality embryo. And as a last-ditch effort, we decided we would go ahead and transfer it, knowing that it probably wasn't going to work. And lo and behold, it didn't work. Negative pregnancy. Now, to add salt to the wound, the other couple got pregnant. This was hard news to hear, but we asked the clinic for this news. They gave it to us in an effort to be transparent, and I appreciated their transparency. I think it's important to be transparent as a clinic as long as you can protect confidentiality. So with this, at this stage, we were pretty devastated. However, the same exact day that I had received this negative news, there was a woman who was in labor at a local hospital. She was single. She wasn't ready to be a mother, and she wanted to find parents for her baby. The next day, the following day, a good friend called me, and it happens that this friend was the patient's labor and delivery nurse. She knew that our last IVF cycle was a long shot. So the first thing she asked us when we got on the phone was, did the IVF cycle work? We told her no. So she told us about her patient. She said that her patient had just delivered her baby. She was single. She wanted to find parents for her baby. She had not made any plans to do this. And our friend had told her about us. And now she wants to meet us. We were beyond thrilled. Oh my God. We rushed down to the hospital and we met her and her baby and we talked. We had a lot in common. We both liked big dogs. We both liked hiking in the mountains. We both liked reading a lot. And I had my biology degree and she was working on her biology degree, still in college. She chose us to be her baby's parents. We were amazed and thrilled. So the next step, we had nothing prepared at home, nothing. We rushed out to Target to do the shopping. We tried to think of everything we could possibly need. Diapers, wipes, bottles, formula, blankets, onesies, a bassinet, and don't forget the car seat. We figured we'd forgotten something, but as long as we had the car seat, we were good for now. We barely slept that night and just fear that it would all fall apart. The next morning, we went down to the hospital and we brought our baby girl home on Valentine's Day. So this is her when she got a little bit older. This is our little baby Megan. Well, the story doesn't end there. Fast forward 2 years. We wanted to expand our family. So to do that, we called the IVF Center, thinking that we may want to be the recipients of an embryo that had been donated to the clinic and do a frozen embryo transfer cycle with that embryo. The clinics told us that unfortunately they had a 2-year waiting list for this process. So with nothing to lose, we decided to put our names on the list and move on. Now, adoption, we were totally comfortable with. We had done it before. It had gone very smoothly. How hard could it be? We'll just adopt again. We could not be more wrong. It was not as we had planned. So to get started, we created an adoption letter that would tell potential birth moms about us, about our family. It was detailed with pictures of our family with our baby. And it told prospective birth mothers how we would be the most perfect family for her baby if she wanted to find parents. We sent this out to OB offices, friends, family, attorneys, anywhere we could think of that people could just tell our story in hopes of finding a lead for a birth mom. We also hired an attorney. We wanted him to help us find a baby if possible. And then when we did, he could do the adoption process, the legal adoption process for us. Now we waited. It was about 8 months later, we finally got a lead on a pregnant woman who wanted to find parents for her baby. She was incarcerated. So we went down to the prison to visit her. We talked, and she seemed genuine about wanting to find parents for her baby. And she chose us to be her baby's parents. She was pregnant with a baby boy. It was pretty early in our pregnancy, so it was a very long wait. But we had such faith and hope, and we were so excited about having a little baby boy. So we stayed in touch. We visited fairly regularly. We sent care packages with essentials and goodies. And finally, the day arrived that she delivered. We got the call from the hospital social worker, and she had delivered a healthy baby boy. We were so excited, but there was a glitch. The birth mom had changed her mind. She decided to keep the baby and let her mom raise it until she got out of prison. We were devastated, beyond devastated. We had been waiting and longing to bring our little baby boy home. We had the rug just pulled out from under us. We felt so deceived. We definitely went through the 5 stages of grieving. First stage was just, we couldn't believe that it happened, denial. This couldn't be happening. Why won't they let us talk to her? Why won't the social worker just let us talk to her? We'll just work this all out. There must be a mistake. Then we went through anger. What the F? Like, how could she do this to us? That was like the lowest of the low. She must have planned this all along. She just used us for the perks. We felt so devastated by this just it was as if she just planned it from the beginning and was using us. And we were so mad at the attorney and her. The next step was bargaining. Well, maybe there's just, maybe she just needs a little more time. Maybe if we could just talk to her, we'll all work this out. She just needs more time to make a decision, and then she'll give us the baby. Well, the next step is acceptance. And I can tell you that took a very, very long time. I did finally get to the point where I forgave her, but I would never, ever, ever let myself go through that again. It was way too painful. So with that stage over, we waited. And a couple months later, about a year and a half into the process of trying to expand our family, we got a call from the IVF center. They called us a little early, and they had embryos to offer us. We were so excited. The embryos had been created from a couple who had hired a birth mom. Who had hired an egg donor. The egg donor, they used the egg donor's eggs and the husband's sperm, and they had a successful pregnancy and birth, and they were done creating their family, and they donated their embryos to the clinic. And now they were offering us these embryos. The egg donor was a dancer. The husband was a computer programmer. So these embryos were both athletic and smart. We were thrilled. So we went through a frozen embryo transfer process. The medications were fairly easy. I was still pretty nervous that it wasn't going to work, and I was still quite fragile from the adoption fallout, but I was hopeful. I was very hopeful. So they transferred 2 embryos to my uterus, and then the wait. And oh, what a wait. That time between the transfer and getting your pregnancy test results feels like an eternity. I tried to distract myself with TV shows, movies, reading, hiking, whatever I could do, but it was still hard. We finally got the pregnancy test results, and they were positive. And then a couple weeks later, we had the ultrasound, and there was 1 healthy fetus. I absolutely loved being pregnant. I was nauseated, and I didn't mind at all. I loved feeling her kick inside. And it was just the most wonderful time of my life. At that point, I was the happiest I've ever been. I had a beautiful little girl who was 3. I had a loving husband, and I was pregnant with our second daughter. I delivered her on 4th of July. So now we had 2 holiday babies, Valentine's Day and 4th of July. And here they are when we got her home from the hospital. That's Megan and her little sister, Sydney. So it's been quite a journey. They're growing up. And the reason I tell my story is I just want to help make it a little bit easier for you. I know many of you are going through a really hard time right now. You wish you were already pregnant. The waiting and not knowing is very difficult. But I want to remind you to keep the faith. You can do this. Here they are, growing up. And now my 2 daughters are 16 and 20 years old. Neither of them are genetically related to us, and we're glad they have this in common. It's something that I think can bond them in a certain way. But they know that they are loved 100%, and we're behind them 100%. We've been open with both of them on their birth stories, and they've both had their struggles, as we all do. But they know that we are there for them 100%. So I hope in hearing my story today that it gives you just a little bit more strength and courage to continue on in yours. I know that for me, just taking it one step at a time, keeping the faith and staying positive was helpful. And I know that if I can do it, so can you. So good luck, and thank you for your time.
Good evening, everybody, and welcome to the Pharmacist Virtual Learning Experience program, brought to you exclusively by Mandell's Clinical Pharmacy. As always, I am your host, Craig Orapello, but tonight we're going to do something a little bit differently. We will continue to have on Monday nights our regular medication education programs with our various nurses, but tonight we wanted to share with you a little something different. So one of our great speakers, one of our special guests that we bring on is Wanda Hafkasang, and tonight she's going to share a little bit with us about all the benefits of healing touch. So right out of the gate, I'm just going to turn it over to you, Wanda. Why don't you just share a little bit of your background and where your interest from healing touch came from, and then we'll get started digging in a little bit deeper. So thanks again, everybody. And here you go, Wanda, take over.
Great. Hi, Craig, and hello, everybody. Welcome to this episode of the virtual learning experience, but a little different twist that we're taking here. We're looking to share with you some tips, some wellness that we can hopefully help allow you to integrate within your fertility journey. And Craig, my background has been, I am a change of career nurse. When I graduated high school in the mid 80s, business was kind of the degree. I really didn't know what I wanted to do. So I actually am originally from Massachusetts. So you might hear that accent come out, Paktika, somewhere in there. I disguise it a little bit, but it definitely comes out. When I say out, I think that's when you hear it. But I came here to New Jersey to go to school, and I got a degree in business, a bachelor's degree in business administration with a concentration in finance and quantitative methods. Woo! I still struggled when I graduated, got out, and actually always knew I loved people, and I really thought about helping. But somehow I still went through the business degree way of things. And as life is, it's not a clear-cut linear journey. It's not one step after the next and everything just kind of rolls forward. Kind of make little lefts and little turns and twists and winds, but you kind of get on a path here and there. So I chose, once I met my husband to be, which we're celebrating 30 years this year of being married. He's been a big supporter of me all throughout everything, and still continues to be. But I went and enrolled into nursing school. I guess it's kind of interesting because I do have two sisters that are nurses. So I kind of felt like this was a great way for me to put what I liked most, which was helping people and being around people. So I became a nurse and graduated from a wonderful program in Montclair, New Jersey. And it was fantastic. And that was my journey that started in nursing. I always enjoyed women's health. And so I was lucky enough, after I did a little medical surgical nursing, which is kind of how you start out to get your feet wet in the beginnings. I was able to work with a smaller doctor's office where they were doing GYN and reproductive medicine. And then I've moved myself through that field with different clinics along the way. And fertility has been the area of interest throughout. So that's really where I am with my nursing background. Probably about 4 years ago, I had a coworker at my present job knows that I love wellness and holistic medicine and looking at better ways for us to handle stress and how can we maximize our bodies for healing. She shared with me, as nurses, we have to get continuing education credits to keep ourselves abreast of anything as we licensure for our license. So it keeps you current. So she told me about a course that was called Healing Touch, and she's like, it's right up your alley. You should register for it. So that was my Healing Touch journey. I had really not heard of Healing Touch. In nursing school, believe it or not, I went back to my books after I started Healing Touch, and I found in my very first semester of my nursing notes, there was therapeutic touch. So this was way back in the 90s where I was in nursing school, but I had one page of therapeutic touch. So it was very interesting because I had heard of it just under a different name. So in this journey a few years back of starting Healing Touch, that was my first exposure, was to a level 1 class. And it's been a wonderful journey ever since. So that's a little bit of my background, and that's a little bit of how I got started in Healing Touch. And so I can tell you a little bit more about Healing Touch. Craig has some nice slides for us that I'd like to share with you, explaining the process of Healing Touch a bit, because it allows you to see some nice pictures. This first one really just lets you know that I am certified through a group called Healing Beyond Borders. There is a board of directors on this group. The Healing Touch program, why I was drawn to it as a nurse, is it's a 5-level certification program. And it has a rigorous curriculum and a standards of practice, which is kind of what nursing does. And it has a code of ethics. So I'm very much, when it comes to certification, I want it to be something that is validated. This program of Healing Touch is validated through the American Holistic Nurses Association, the National Institutes of Health. It is practiced all over the country, this country and other countries abroad. There are many, many thousands of Healing Touch practitioners out there. I'm not so sure why it doesn't get the accolades it should, but I think sometimes as practitioners, we're rather quietly going about doing the work. And so that's a reason why I sometimes think we're just going about our business with this, and maybe we're not always doing events like this, but I know for me, I've been trying to get the word out as much as I can. So just wanted to mention this slide because I want you to know that I have been educated and certified through a very wonderful program, and that's important to me, and it should be important to you if you're working with a Healing Touch practitioner. I want you to know, whoever they may be, they have done an awful lot to obtain certification. You can do the next slide, Craig. So what is Healing Touch? Healing Touch is an energy therapy working with our biofield. So you may have heard the word aura, and we have this energy biofield around our bodies. We are little bundles of energy. How I guess I would relate this into something that you could maybe understand even a little better is, think of when you might be having your heart checked and you go for an EKG. An EKG is checking the electrical impulses and signals of the heart. Maybe you're getting an EEG, which is looking at some signals in the brain. So it's interesting that we use tests that are testing energy. And so sometimes we don't really relate to that. We don't really not really think about the fact that we are absolutely little bundles of energy. And there's a lot going on there. So Healing Touch is a relaxing and nurturing energy therapy that's working with this biofield that is a part of each of us. Next slide. It works in harmony really with standard medical care. I think the biggest thing I would want you to know about Healing Touch is it is not a cure. It is something that absolutely works with standard medical medicine, because we need that. And I feel like it's very much so a complementary therapy. I would have you think about, like, chiropractic works with the musculoskeletal system. The chiropractor is trained in the musculoskeletal system and looking at aligning your body for optimum function. An acupuncturist, they're looking at the meridian system, which is like a network, a matrix, if you will, of energy pathways. That both of these, along with Healing Touch, which is working with the energy field, the energy centers, the chakras, and the energy field, they're all looking to align, balance, and bring your body to working at its best, be in harmony, so that you can be as healthy and vibrant as possible as you go through your life every day. Next slide. It involves gentle touch. So with Healing Touch, you're lightly touching the body, but there are also techniques where you are working above the physical body. When somebody might be in physical pain, touch might be a little too much for them. So the wonderful thing about Healing Touch is it doesn't even have to be touch at all. When you are working your hands through the energy field, you are still working to keep that energy field and that energy flowing in that within that person and that system of that person. So we're just this physical body. This is the vessel that we're all in, this physical form. but we are surrounded by, again, this energy field. So if the hands of a healing touch practitioner are in your energy field, they are working to balance that field. And in turn, what that balances is your physical, your emotional, your mental, and your spiritual well-being. So it hits us at all levels. And we all know the buzzwords of hearing the mind-body connection. And this truly is about the mind-body. That's what healing touch involves. Next slide. Healing touch works with our natural ability to self-heal. I think what sparked me most about healing touch was how something that seemed so simple, but I think it is somewhat complicated, but we tend to make it complicated. But something so simple as using the energy centers that we all have in our hands and using those to perform or share and exchange a healing touch session with a client, a patient, it really has such a profound effect. But it's not that as the healer, I'm the one doing the work. I am just the one that's allowing myself to be a conduit of the energy that will flow through me as a conduit, but it goes to wherever your body needs it. So there isn't anything special you're supposed to feel during healing touch. You may feel nothing. You may feel tingling. You may feel warm. You could feel cool. There's always, I don't like to suggest what you're going to feel, because there's always, in our minds, we want to know if we're feeling the right thing. Is it doing the right thing for us? And what I want you to know is there's no right or wrong with healing touch, because the body seems to know when you are having a session where it needs to go, so that that body, the energy goes where it needs to flow to your, through with, and with your body, with that practitioner, because it depends on what your body needs. And all of us, our body needs are different at any given time. Next session. Really, what also is most important that I love about this slide is the lady in this slide is Janet Menken. She was the founder of Healing Touch in the late 80s. She was a holistic nurse who developed this program and really followed the nursing process with the certification, the rigorous curriculum, the standards of care, the code of ethics. But the biggest thing that she says is do the work, in quotes. And that's why I say, I think a lot of us in Healing Touch that are practitioners, we are just quietly doing our work. We're going about our business. And maybe that's why sometimes you may not have heard about it until you experience a session and you find somebody that's certified. But I'm hoping that through this episode here with our virtual learning experience, that it opens you up to doing a little research, checking it out, because it's amazing. It is not just for nurses. It did start out that way as a certifying program for nurses, but you as a layperson can also become a certified Healing Touch practitioner. One of Janet's biggest things that she feels and has felt is that every home should have one person at the very least that is trained even in just level 1 Healing Touch, because it has such an effect. So I can honestly say I love sharing this with my family, my friends, my coworkers, etc. The biggest thing is that it comes from the heart. It's an intentional, you set an intention and you really place your heart in such a space that you don't look to attach yourself to any outcome of what the client's going to feel, the patient's going to feel. You simply just do the work with a very conscious, intentional process of your heart. And you always ask for the highest good of the person with whom you are sharing a session with. So we're directing energy through those hands, but allowing ourselves to be that conduit of energy through that intentional, heart-centered or heart-based intention. It's safe for all ages. One thing I found that I will share as well is I did a Healing Touch for Babies certification program. It's a little branch of Healing Touch where we're always, even as Healing Touch practitioners, believe it or not, just like nursing, we continue to get educated. You continue to educate yourself even within the Healing Touch community. And I took a Healing Touch for Baby with a certified Healing Touch nurse who works out on the West Coast in critical care, intensive care unit, pediatric intensive care. And oh my goodness, realizing that babies have this little energy field and understanding that sometimes when you're in the environment of a hospital, the sounds Babies are taking in a lot of what's around them, but they're not verbal yet in terms of expression. So talking gently and gently touching a baby can actually, if they're hooked up to any of these EKGs or EEGs, it's amazing the effects that someone who's trained in healing touch, those those types of tests can actually slow down the heart rate. They'll see a calming of a baby's respirations. It's just incredible. So when I say it's for all ages, men, women alike. Everybody can benefit from healing touch. The benefits really kind of described here are a lot with most therapies that are considered conjunctive therapies to streamline medicine, standard medicine practice, but definitely it works on pain. It can enhance comfort. It's helping to reduce any sense of anxiety, stress, worry. It can strengthen the immune system, believe it or not, promotes relaxation. I have had the fortunate abilities to be with people at end of life, and having done a couple sessions with some cases that I can tell you that I know I've done with some friends, parents who have been at that stage, it's incredible to watch. I don't even want to say to watch, that's probably not the best term. It's incredible to be a part of that person's end of life experience, and knowing that you shared with them in helping to promote comfort and decrease of pain and a sense of relaxation. I'm getting goosebumps just actually thinking about a few of the people that I've done this with, and that's because I was very honored to be a part of their end of life as a nurse, but also in that journey just as a healing touch practitioner. So I can't put it into words, but the experience was profound. Research is actively being done with healing touch. And what I will say to you is there's always ongoing research with healing touch. It will continue to be researched because we need to know that there are other modalities that can be a part of a complementary care system to individuals when they are in distress, whether it be somebody going through chemo for cancer treatment, whether it be somebody going through a surgery and you're prepping them preoperatively and postoperative recovery. Remember, our bodies really do know how to heal. It's just sometimes in the hustle bustle, the fast paced world that we are in today, we don't slow down enough to give and work with some of these treatment therapies that can be of assistance to the body's natural innate healing abilities. So all of this research that we're doing is only beneficial in getting the word out and validating the benefits of healing touch. As I said, the credentials and training I mentioned a little bit, and I will show you when we get rid of the slides there, but I even have it here. This is my certification. This is everything that I worked very hard for with this little piece of paper, which certifies me through Healing Beyond Borders as a certified healing touch practitioner. I can tell you that as a nurse, I was in a 3-year diploma program, and my healing touch certification was as equally as rigorous. It was tough, but it is meant to be. Anything worth working towards should be sometimes difficult. There should be hurdles with that, because that means at the end, you will be rewarded. And receiving that certificate was literally like receiving my diploma for my nursing degree. There was so much that went into that. I have a booklet here that is a professional booklet that you'll see is rather thick. It's busting at the seams because part of my training, there is a 1 year of what they call apprenticeship. And what you do during that 1 year before you go to level 5 is you work on building a portfolio. And you have to document over 100 healing touch sessions, which that is my booklet here, which is my documentations. I had to have where I completed other healing touch assignments, which were reading books and giving book reports, doing case studies that I had to pick a person and walk through doing many sessions and go through the process of what they felt, what I felt, what was the outcome, did we meet our goals? And the case studies sort of prepare me for research. because being a nurse, the wonderful thing is I can go forward with being a practitioner and a nurse and implement this and do some research. So that's a great way for me to have been able to, as a healing touch practitioner, already kind of sink my teeth into that. And just this whole professional profile book that I showed, that involves doing community events. I held 2 wellness events at my present fertility clinic for employees. I did a nurses wellness week for Nurses Week. I've done numerous community events. So it is all about doing the work, as I said, that Janet Menken has said, and it is really about the heart-centeredness. And honestly, if there's one thing I can hope that you would get from these slides is really just knowing that if you ever come across a healing touch practitioner like myself and you venture into the experience, what I'll take is from the movie Santa Claus, which is, if you remember Tim Allen, and he was Scott Calvin, I believe, in that movie. And he had this experience where he was being called upon to become Santa Claus. And he was struggling a little bit with that. And he said, that believing the little gal that was in there, the Judy, the little helper, she said, believing isn't seeing. Seeing is believing. Seeing isn't believing. Believing is seeing. So I would almost say that that's how healing touch works, is that there's not something that you're going to actually see from it to believe in it, because you have to just give it a try and experience it. But I think through the experiencing of it is where the seeing comes and the believing. So that's just my little anecdote to that, is how to bring that to us all. And then here you just see that this is the credits given for the photography that was part of this PowerPoint, which is the Healing Beyond Borders group that I am certified through.
Well, that was great. Thank you so much for walking through that and sharing all of those great examples and stories. And like you said, I think it is new to a lot of people. It's probably they don't get the coverage that that is warranted. So a lot of patients probably have a lot of questions about this, or just people in general that could benefit from it. By the way, I do want to say great choice of using the Santa Claus as your example movie there. Very excited. Gets a lot of play around the holidays at our house. But I do one thing, just speaking kind of about it, as you had mentioned, because there's so many people that don't necessarily have that familiarity with it. To a lot of people, it sounds almost kind of like magical, right? It sounds like something that is they don't really understand how it could work. And having gone through that, I guess one thing that I'd love to know, and I know people out there want to know, what is one of the most interesting or like different types of situations that you found yourself in, experiences that you found that were something that really kind of changed your perception of healing touch as you've been going through this for quite some time now?
So I do have 3 experiences that I will share about that. Actually, when I had completed my level 2, so I was still kind of new and trying to figure this out for myself. Even as a nurse, I know touch is very important, holding a patient's hand, sometimes placing your hand on somebody's shoulder. It's just kind of, there's that release. And so I was still new, though, still trying to figure this out. And we were practicing, certainly part of the curriculum when you are attending, and it usually is at least a 2 full day or 3 full day coursework. When you do one level, it's a 2 to 3 day commitment and an all-day event, and you're with other students who are learning, and you're giving and receiving, and you're listening to all of these techniques and whatnot. So I was after level 2, I was in a little class that was in a small gym that I go to, a safe gym, and a good friend of mine actually owns it. It's a personal training gym. And so I was in there with 4 other women, and we were doing a little small class, and we finished the class. And I had turned away because I was going to leave. And one of the students had gotten up, and all of a sudden she couldn't walk. She had like severe pain in her knee. And I think what had happened was she was sitting in a little style with her legs crossed. And when she got up, it's just her knee was kind of torqued a little bit. So I was like, oh my goodness, my nursing goes into effect right away. I'm thinking nursing, ice it, what's going on, or assess it. So there with my friend who's the trainer, he's, massaging the leg muscle, trying to relax it in case it was a muscle cramp, massaging the lower leg. And she's like, it's really not getting better. And she would try to stand. And here we are trying to think this through. And I looked at my trainer friend and I said, hey, Dan, I said, can I give Lisa healing touch? And he's like, oh, what the heck is that? Healing touch. he was being kind of a skeptic. And I was like, you know, a little disappointed at first, but then I kind of persisted. And then I realized the one thing that I was taught in level 1 is part of healing touch is you ask permission to exchange, I shouldn't say exchange, but share a session with the person you want to share. So I thought, I don't really have to ask Danny. I really have to ask Lisa if it's okay if I do my healing touch technique. And the one technique I was going to do is what's called a hands-on technique, or hands still. It's where you place your hands on the affected area that might be experiencing pain. And you're doing it through a heart-centered intention. And in that case, I was sending a message to that area to open up and allow her to get back up and walk and be free of any pain. So I asked Lisa, I said, Lisa, I know you don't know what healing touch is. I'm in a level 2, I'm a nurse, you know that. I said, I promise that, you know, I'm not gonna harm you, but, you know, we'll see if it helps. Not quite sure. So I proceeded to ask permission. I proceeded to connect with her by putting my hands on her shoulders. I stood behind her. She was sitting in a chair. And then I walked around and her knee was there. And there was no swelling. There was no redness. There was no whatever. It was just painful for her to put pressure on it. So I gently took my hands and I went through my intentional process from my heart. And I placed my hands on her sides of her knee. That they were guided to be placed there. I have to be honest with you, because I don't really know why I placed them there, other than that's where they felt like they needed to go. And when I placed them there, I wasn't really on there for more than 30 seconds, just a gentle hold. And all of a sudden my hands went, boop. And I was like, are you okay? Is everything all right? And she was like, yeah, what the heck was that? And I had an audience of about 5 other classmates at the time, and they all went, you know, because, and I said, well, try to stand up. And she immediately stood up and she was able to walk around, and she's like, Wanda, what the heck was that? And I'm like, it was just your energy was stuck or blocked. And I was just doing my best to send the intention of healing to that area. And so that was after I was a very new level 2 as student, not even certified healing touch. But it was at that moment that I knew there's something about this. And so again, that one little moment when that happened, one of the women from that class ended up inviting me to her home for a holiday party. And she was doing little wellness things at the time, essential oils and other little things. She goes, I want you to come, and I want you, if you'd like to like offer healing touch, would you love to do that? And I'm like, yes, as a student, I need to do this community event. So it really opened me up to the giving, the community event, and just the confidence in what the heck did I do? But it wasn't about me. I realized that as well, is that it was just about me opening up, really believing in what I was doing, healing touch. And that's a very profound example of it. The other example I will give is I have to practice what I preach. And in 2012, I had dislocated my bicep tendon. And at the time, I didn't have any rotator cuff problems, but I had massive weakness. So I had to work through that. So I kept my shoulder pretty good for 6 years. And then in 2018, kind of had to come to the realization that I needed shoulder surgery, which anybody who's had rotator cuff shoulder surgery, I'm a nurse, I know this stuff. It's intense. Any surgery is intense. But what I will say to that is, yes, it's intense, but I worked with all of my healing touch angels, as I will call them, because really that's what they were, friends who were also practitioners, other mentors. And I lined up everybody pre and post-op. I did a lot of healing touch beforehand to get my body ready for surgery. I did a lot of guided imagery, letting my shoulder know I really appreciated all it was doing for me. But unfortunately at this time we had to do a little extra help to get it working right. So actually part of guided imagery is a lot of just letting the body part know that it's okay, it's going to be whole, but we're going to work on you. And so I had to have a bicep tendon kind of moved back in place. And at that point, I then did have a rotator cuff injury. So I had to get that done. And I will tell you that, you know, I can raise that left arm, which is my arm that I had surgery in, and I can push up still with weights that I was not able to do. And I had pain for a long time that I just kind of dealt with. And the surgery was necessary. So that's what I'm also trying to point out, is that standard medical care needed to take care of the shoulder. And by all means, thank you to my orthopedic surgeon. but also I incorporated a lot of this other healing touch techniques that helped me with recovery and helped me regain strength and mobility, which is key. And that is one of the things that I thought I've got to put my money where my mouth is and use the healing touch and believe in it, even for myself. So it allowed me to receive as a healing touch practitioner, not just give, which is great. There's that giving and receiving aspect to this. So those are really my two kind of experiences that were foremost in giving and receiving as a healing touch practitioner.
Wow, that's amazing. I mean, those stories are definitely very, very amazing to hear, and it's cool to hear examples of how it can work. And I can say selfishly on my end, as I'm getting older, I randomly have pain for no reason whatsoever, just it's because my body is betraying me every day. So I would love to know, and I'm sure everyone out there who's going through, whether it's just stressful situations that can be calmed down, or physical pain that can be assisted with. Obviously, you haven't gone through the different levels of training to be an expert in this, but is there anything that, like, we at home, some of the examples that we can use ourselves to help in those moments of pain or anxiety or anything like that, where this seems like it'd be a great home remedy to be able to use if possible?
Great. That, you know what, Craig, that's such a great question, especially with you mentioning about your body as we age. Listen, I'm 55 years old and I've been active throughout all of my life since high school sports. But you have to kind of work with your body as it ages, and you have to become a little more gentler and realize that you can't do those box jumps. You can't always be doing those burpees, all of that high intensity. I still love it, and I try to think I can do it, and I do utilize it, I will say. But I think a big part of what I can tell you with that is that when you have some generalized, just the achy joints, that getting up from the bed, sleeping, we should all feel pretty well rested after that. And so what I would say is that not many of us, if you don't know about energy medicine, not many of us are probably utilizing what we can do with our energy field. So something that is a great technique, and I'll have you put it up in just a minute, is going to be a chakra connection. So we have these energy centers, and I've shown this on previous recordings for our virtual learning experience, which we have energy centers in the center of the body, okay? And we also have our joints. They are small energy centers, okay? Kind of think of, and I'll use another movie, The Wizard of Oz and the Tin Man. Oil can, just meaning that things get stiff. The joints are really, they go through a lot, our joints. And so, you want to get your wrists so that they're moving. You want those elbows to be able to unhinge so that you can not have to have carpal tunnel. You want your shoulder, some people have the weight of the world on the shoulders, and who knows, maybe I was having some stressful times. And if I look back that year that I might have done some injury, there might have been something emotional going on that felt like the weight of the world. So some of these things that we say about ourselves, with, the weight of the world, or I have, somebody's being a pain in the neck and you have a little neck pain or what have you. We all do it. I do it too. I'm human, just like everyone else. But I really pay attention to myself when I think about this. And I can tell you, I use some of this self chakra connection I use daily. If I go and work out and I feel like one of my knees feels a little funky, I will hold my knee. So hand still is when you gently put the hands on an area. So in this self chakra connection, what you will see walking through steps 1 through 16 is you are gently holding the upper joints and the lower joints. And you start with the lower part of the body typically and work your way up. So what you'll see here in this chakra connection is each of these positions hold, roughly for 30 to 45 seconds, a full minute if you'd like, using just your hands. And before you get started, sit up, take a few nice, just gentle, count into 5 with an inhalation and out, an exhalation 5. Do that, that's 1 round. And if you do that 3 times, put some gentle music, be in a room that you won't be interrupted. And what you'll do is you can have this little sheet of paper out in front of you and walk through in a seated position. You'll cup each foot with one hand on the top of the foot and one hand on the sole of the foot. Your feet are also energy centers. The feet are how we take in grounding and the earth of the energy, the earth energy from the earth. The up here is kind of how we take the sun energy. Sun and earth are really moving through the body, working with our body. But sometimes, like I said, with being tired, stressed, injury, there's blockage, okay? There's stagnation. So these are great little tips. And when you follow through, you would do the tip of opening up the feet and then connecting the foot or the ankle area to the knee. And then you connect the knee to the hip. And you do that for both sides. And then you connect both hips by holding the hands gently there for approximately, like I said, anywhere from 30 seconds to a minute. And then starting on that second little row there, we have what we call the energy centers that you're going to work with, which is your root chakra. That's right a little bit below where you're sitting, the seat. Just gently place your hand there and you connect to your solar plexus, your sacral chakra, which is right below the belly button. One hand on that root, one hand on that sacral for 45 seconds to a minute. Then you move with trailing hands and you put your hand on that sacral chakra, and the solar plexus is right below our ribs, right in between where the ribs kind of branch off. Right in there is the solar plexus. So you then are helping these two energy centers connect, open, and balance. And then we actually do the solar plexus to the heart. We do the heart to the high heart. There's an area here that is considered your high heart. This area is great to energize for the immune system. And then after you get finished here, then you're going to work with your upper joints, which is holding the wrists. And then you would hold your elbows. And then you kind of give yourself a nice hug and you put your hands on those shoulder joints. And once you're done with the upper body, you go back to finishing up the main chakras of the body, the energy centers, by doing your high heart to your throat, and then your throat to your brow chakra, and then your brow to your crown, and then your crown to what we call transpersonal, which is really just the energy above you. And I like to think of it as the nice sun energy, that nice energetic bright light of the sun. So you're bringing up earth, sun, and you're opening up the joints as well. Even these little techniques of doing a full self chakra connection, you could break it down. If you're having elbow pain, hold your elbow. And that you can do for even up to a lot longer, do like 5 minutes. I do this all the time, guys. One area I will share with chakra connection, and I think, Craig, you kind of touched upon it with area of stress, is our bodies aren't deficient in Tylenol and Advil when we take them for a headache. Sometimes it just is that we're stressed, overtired, we didn't get a good night's sleep, and the energy in this area might just be stagnated or blocked. So that's where you can do a little bit of this, holding the back of the head and the brow, or holding the sides of the head and connecting. That's that little upper part of the chakra connection that can be helpful for that. Because I'll tell you what, at my work, there's a lot of stress of sitting at computers, looking at screens, even with working from home, etc. And this is a great little tool to use for those like times when we feel a little headachy. And believe it or not, most everybody that I've done that with at work, they usually are going to hold off taking the need for any Tylenol or Advil because it opened up the energy center. So, the energy knows from my hands, if I'm a practitioner and I'm putting heart-centered intention to help saying, heal for their highest good, heal that area that's having some troubles. When I kind of focus on that area for that person, my ability to bring the energy through is really what's working well with that person when I share and connect. So in closing about Healing Touch, what I would say is I really hope you find this helpful. I really hope you are able to incorporate some of this. We're also going to include, and Craig will be putting these up for you to see, but they will be a part of the Facebook page and the pharmacy page. is the chakra tune-up. And it just talks a little more about the energy centers, the chakras. And what it sort of lets you know is, our energy centers resonate and vibrate with frequencies. And vibrating, that's why music therapy can be so great, because what you'll find there is, because of that music therapy and those musical notes that kind of are aligned with each of these chakras, and colors, the colors of the rainbow correlate to each of these chakras. It allows for everything to sort of work harmoniously. So my goal for everyone is to share what Healing Touch, or my goal tonight was to share what Healing Touch is, to demystify what the fact that we are energy beings, and use the examples of the EKG and the EEG, and certainly let you know that we already are working with those things for a very long time. And so this is something that we can all use and benefit from. And I would say that in light of this past year, what the biggest thing that I would say that this type of therapy and chiropractic or acupuncture, reflexology, qigong, meditation, yoga, immerse yourself, pick up and do a search, look up all these different methods, and incorporate what you feel your passion becomes your passion and what resonates with you. Because I use a multitude of everything every day when I can. Sometimes very small amounts of time I can have to do a quick 5-minute meditation, but the benefits to your overall health will really keep you in a good state of being, which hopefully for all of us is where we want to be when it comes to something like that we were dealt with this year. It keeps our mind, our body, and our spirit aligned so that we can be of optimum health and be able to comfortably work through any sort of sense of surgery or stress or what have you. It doesn't mean we won't have those things in our life, but it just means our body will be in a much better space to be able to take that in and work through it, if we're opening up these energy centers and keeping this energy moving. And however you do that, all of those methods that I mentioned all work on that energy, the meridians, the spinal system, the energy field, the chakras, everything. That all just helps to work together and works with standard medical care. And so we hope that this can help you even through that journey of fertility, in working with the standard medical care and the techniques and the procedures that you have with that. This is allowing your body to be able to be in an optimal state during, before, and after those treatment cycles.
Thank you so much for all of that great information, Wanda. I definitely know I learned quite a bit today. And this is something I know we talked about a little bit on some of our other VLEs, but to really be able to deep dive into it and share all this great information, I think is very helpful for people. And one of the things I do just want to say that our normal Monday night programs will resume, the medication education programs. I know this is a little bit different than that, but we really wanted to share very interesting and a little bit underutilized or under-recognized technique that Wanda has such expertise in that can help all of us at home, whether it's to help through the IVF process itself and the fertility journey, or just generally because the family was over for the holidays and you just need to decompress a little bit. We are here to help you. All of us at Mandell's Clinical Pharmacy want to say thank you so much again, Wanda, for your time today. This video will be up on all of our different sites. So on our Facebook, our YouTube page, you can find it on our mymandellspharmacy.com/pharmacist. And as mentioned, we will be back next Monday night with another medication educational program. And you can expect to see a lot more programs like this coming up. So feel free to let us know on the Facebook page if you have any topics or ideas that you at home would like to learn a little bit more about from our panel of expert nurses. Thank you again, everybody. Have a great night. Hope you had a great holiday. And we will see you next time on the Pharmacist program with Mandell Clinical Pharmacy. First off, I want to say thank you to all of our wonderful nurses for sharing their personal stories and for bringing some new information to you. And my name is Craig Orpello. On behalf of everyone over at Mandell's Clinical Pharmacy, I want to thank you at home for taking your time to listen to this program tonight. We hope that you got something out of it. We hope that you feel supported. We hope that you understand that all of our nurses and everyone over at Mandell's is here to support you throughout your journey. And we are so thankful that you took up your time to listen to us tonight. As always, next Monday night, we will return with a regular Pharmacist Virtual Learning Experience, where we will bring a couple of different products that you can listen to, watch how we demonstrate them, and then answer some questions about them. So feel free to jump on. You can join us via Facebook or Zoom and bring your questions right to the table. So as always, you can find all these videos, including the one that you listened to tonight, on our YouTube page, our Facebook page. You can find it over at our homepage at mymandellspharmacy.com/pharmassist, along with all the other VLEs that we've done in the past, and also the individual products and their demonstration videos. So once again, we hope you had a wonderful holiday weekend. We hope that this helped a little bit, helped to feel a little bit more supported, help you get through the weekend, help you get through some stressful moments that you may be feeling, whether just because of a holiday or because of your infertility treatments that you're going through. And we just say, share this program with somebody that may learn from it as well, that could do with some great information, whether it's a family member, a friend, or a colleague, somebody that you know that's going through this treatment that could just use a little boost of support today. So thank you so much for joining us once again tonight. We look forward to seeing you next Monday night at 7 p.m. Eastern. And again, Craig Orapello, on behalf of everyone back at Mandell's Clinical Pharmacy, thank you so much for joining us, and good night.